Hello, everyone. Thank you for participating in this third webinar in the series that is exploring digital health literacy. My name is Mona Matthews. I'm a program manager at MetaStar. Today's topic that we're going to be covering is emerging technology trends to improve healthcare virtual or to improve healthcare. This is a part of our virtual learning series, and you see there that it's session number 3. I will put a link to the previous sessions in the chat for everybody as soon as we get started. But to start off, I want to introduce Lori Joyce, a project specialist with MetaStar, and she will be reviewing this topic today. Thank you, and I'll turn it over to Lori.
Thanks so much, Mona. If you also would like to put the link to the slides in the chat at some point, I know a lot of people like to take a look at those on their own as well. Well, hi, everyone. Thank you once again for joining us or for joining on the recording that is available as well. I just wanted to go over some objectives. Now, obviously, this is a very broad topic, and we're not going to get to everything today in what I'm hoping is about a 20-minute presentation followed by some discussion. However, I do really hope that each and every one of you can take away just a couple of pearls of things to think about. The first objective that we're going to be talking about is understanding patient access rights under HIPAA. A lot of times we think about all the privacy piece of HIPAA, but today we're going to focus a little bit more on the patient access rights there. And then also understanding what some common patient access tools are, specifically patient portals and how those can be used and implemented, as well as some of the new technology, the APIs or applied programming interface, which in layman's terms, let's think of as healthcare apps. And then the third thing that we will be discussing today is understanding some disparities, some new data and disparities in patient access to electronic health information as well. And so if you do have questions or comments, please feel free to use the chat. Mona will be watching that. Or else also feel free to, we'll be doing some Q&A at the end as well. The first thing that I just wanted to do was sort of set the stage with a video so that all of you don't need to just listen to me talk about this subject. I'm going to get this going and then put it in full screen here.
You need to know and understand your right to access your health information and medical records. This short educational video includes key information to help you better understand your rights regarding your health information and your right to provide access to others of your choosing, including family members, caregivers, or a mobile device application, often called an app.
Your right to access or see and get a copy of your health information is regulated by a law known as the Health Insurance Portability and Accountability Act of 1996, or HIPAA for short. HIPAA is designed to work for you.
During an annual checkup visit to his primary care doctor, Martin asks Dr. Allen about a heart health application for his smartphone that he recently read about. While Dr. Allen is not familiar with that specific heart health app, she is supportive of Martin's proactive interest in managing his health. Martin has the right to request his health information be sent to anyone of his choosing, including family members, caregivers, and electronic devices, which includes mobile device applications or apps, such as the Heart Health app he just described.
You may be required to fill out a form to request your health information. However, your doctor cannot require you to make a separate trip to the office to make your request. Your doctor must provide you with other ways to make your request, such as by email, fax, or online.
Martin asks Dr. Allen to transfer his health information regarding his heart condition to the Heart Health app. She tells Martin that she will check with her technology staff to see if she's able to do that. After Martin's checkup, Dr. Allen's staff confirms with the technology department that Dr. Allen is able to transfer Martin's information to the app without creating security risks to their information systems. Dr. Allen's staff tells Martin that they will transfer his information to the app, but once the app receives the information, they are no longer responsible for what happens to those records or for their security. Martin thanks Dr. Allen and her staff for their time and promises to follow up at his next visit regarding his use of the Heart Health app.
Once you obtain your health information, you can do anything you want with it. However, it is important to make the decision to send your health information carefully and that you understand the privacy and security implications of sending your information to others. For more information on how to keep your health information private and secure and options for sending to others, including family members, caregivers, and apps or other devices, you can visit healthit.gov.
I'm going to stop right there as it kind of gets into some other resources that are available. But just so you know, that video is available publicly, and obviously it is kind of from that patient perspective. And what I really enjoyed at the end was the fact that they really emphasized the onus really is on the patient for protecting that health information once they have received it. So just to review a few other points regarding health information access rights for patients is that patients do typically have the right to receive their medical information typically within 30 days. Patients also do have the right to request changes to their record. Now, if the clinic agrees with this change, so something is wrong in the record, it should be corrected within 60 days. However, if the clinic disagrees with the change, so for example, maybe someone is disputing a diagnosis or something like that, and the healthcare professional, the care team has said, no, this is correct, that the correct information as deemed by the healthcare organization should stay in the record, but that the patient disagreement should be noted in the chart. And patients also have a right to know who has seen their record and how their health information is used. That is typically covered in the notice of privacy practices that clinics typically give to their patients. Now, as I mentioned before in the video, I felt, especially towards the end, really highlighted is that patients really need to understand their role in protecting their own health information as well. And for many patients, and I'm sure you can think of your patient population in particular, you need to keep it very, very basic. They don't know a whole lot about encryption and all of the technical jargon that goes with it. But here are some tips that I think would be helpful. And that is never post anything health related online that you don't want to be made public. Sometimes patients need a reminder that the internet really is forever, and to use passwords to protect health information on personal devices. Even cell phones and things like that can all be password protected. And then also to pay special attention when using public computers. Many patients still use places like the library on a regular basis to access the internet, especially if they don't have great broadband service at home. So make sure that no usernames or passwords are saved on those devices. And also patients need to protect themselves from medical identity theft by shredding any insurance forms, prescriptions, the after visit summaries. I know I've seen one or two of those even out in the parking lot that maybe have slipped from people's hands. But just, reminding them to be careful of that and to shred or in northern Wisconsin, burn these kinds of things. I have a little burn bag under my desk right now that we'll be using for a campfire, hopefully shortly. And then moving on, some common health information access tools where patients can really do things themselves would be through patient portals as well as these application programming interfaces or APIs. And I'm going to start with patient portals. Now, these are typically associated with EHRs, and every EHR is different. And sometimes things can be customized, sometimes they can't. Sometimes certain features are easier to use than others. Sometimes there's additional cost if you want sort of an upgraded version. And so many times you're to a certain degree tied to the patient portal that your EHR provides. The other piece that I wanted to make folks aware of that I know I have really enjoyed personally is the fact that some insurance plans are offering portals that are starting to aggregate patient information from various clinics or healthcare settings and having that all available in one spot. And I know for me and my family, that has really, really helped us a lot. And then APIs, which I'll be getting into a little bit more here. And so the benefit to patient portals, and this is benefits to the clinic. It can reduce call volume. So for example, getting immunizations for summer camps and school and all of that, that can be accessed via the portal, and that can really reduce the burden on front office staff as well as nursing staff, who typically are the ones that are looking up those vaccination records. And many times it's a last minute, oh, I'll be there at 3 o'clock this afternoon, and there's the scramble and everything to try to provide that for the patient or for the parent. Improved responsiveness to patients' needs. So patients can take a look at their test results and have those more readily available. Same with immunizations. Same with reminders of when their next visits are. Lower utilization of health services potentially. More effective care because patients can be more engaged and more knowledgeable about their health care. And then there's always that potential for cost savings as well. I think one of the most important things when you think about the success of a patient portal is making sure that it's as easy as possible. And once again, sometimes you're stuck with the EHR you have and the sign-up process, but really trying to make that as simple and secure as you possibly can. And facilitate signups with automatic portal enrollment. Many clinics request a patient's email address when they're a new patient or when they're there for follow-up visits, and having that push out where there's an invitation to join the portal. And building in-office portal registration right into the care delivery workflow, so that it's something that there's someone there who's recommending the portal, as well as can help answer questions or point patients in the right direction. And then also can really communicate benefits of the portal to patients. So for example, maybe it's at, many of you have clinics that have in-house pharmacies. The pharmacist can point out that refills can be requested through the portal if that is one of the features. Same is true for labs. When you're having labs drawn, that's another great place to say, hey, these are going to be available within a day or whatever it is at your clinic on the portal so that patients can look at those as well. And then activating those portal features, some of which I just mentioned, that really meet the patient's needs. So a couple are online appointment requests as well as prescription refill requests. I know that I've heard a lot of issues. Some clinics have gone so far as to try to allow patients to schedule certain kinds of appointments online. And I know that can be a very difficult thing to implement, but at least the ability to request an appointment so that they don't have to call in and don't have to worry about wait times and things like that. Setting up secure messaging to streamline patient clinician or patient care team communication, as well as the ability to share notes to help patients understand and act upon their clinician's advice. It's also a great place to provide educational resources as well as community resources. Depending on your portal, many of those are available and are high quality. In some cases, portals can be customized so that if there's a certain educational piece or resource that you want to add, sometimes that can be done. Depends once again on the EHR. And really providing that one-stop shop for forms, paying bills, taking health surveys, doing all of that paperwork in advance. I know I really appreciate that, being a busy mom. Most of the time, they're saying, oh, come 15 minutes early, and I'm lucky if I can get there in 5 minutes early for the appointment, and being able to do all of the paperwork at home and the portal really helps things. And I know for myself, at least, it makes it more accurate as well. So that when they're asking for last date of, annual physical or wellness visit, that you can have a moment to actually look that up. And then I did want to share one other quick video, and this is about APIs. And this is actually available for clinicians or patients who are new to APIs as well. So I'm just going to go ahead and just do a little bit about what an API is and how these are being used in healthcare for those of you who maybe are new to this kind of technology.
APIs can revolutionize healthcare. In 2015, ONC recognized the potential for APIs to revolutionize healthcare data sharing, as it has already revolutionized data sharing in other industries. ONC issued a regulation that included certification criteria for APIs. Using APIs as part of electronic health record systems, or EHRs, can make it easier for patients to get and share important health information. APIs can also help healthcare providers share patient information with other providers securely and efficiently. What is an API? APIs are messengers or translators that work behind the scenes to help software programs communicate with one another. If you have ever used a web-based application or a mobile app on your computer, smartphone, or tablet to purchase a flight or pay a bill, you've probably used an API. Today, APIs have become an integral part of both our personal and business worlds. ONC has adopted API certification criteria for electronic health records to help enable access to health information for clinical and patient-facing uses. How can APIs help patients? Let's start with something you're familiar with. Think about searching for a flight. Before APIs, people had to visit.
I'm going to stop it right there in the interest of time, but if you are interested in more of the modules, the link is available in the slides to learn more about that. I actually had an opportunity to use an API back in 2021. I was going to a conference that required proof of COVID vaccination, and they had an app that I actually connected my health record to, and it pulled that vaccination record over into that application, so that when I went to the conference, I could very quickly show, yes, proof of vaccination. So it was kind of interesting, and that's just one example of the many uses of APIs or healthcare apps as well. Another common one is fitness trackers, and getting that into wellness portals as well as health portals as well. And so those are just two examples that come to mind. The final thing that I kind of wanted to make sure that everyone was aware of, and I thought might be interesting to think about, is recently the ONC did publish some data that shows the disparities in patient access to electronic health information. And I do have a link to the full report. But basically, what it says is that in 2020, about 6 in 10 individuals nationwide were offered access to electronic health information by their healthcare provider via a patient portal. And overall, about 40% of those offered a portal viewed it at least once in that 12-month period. However, despite the growth in portal engagement, I remember back in the meaningful use days, we were struggling just to get to 20%. And for many clinics, that was a barrier. It just wasn't going to happen. Studies have identified racial and ethnic disparities in patient portal offers, access, and use. And so I wanted to share this. What the study found was that there is a significant difference. Now, this particular study was only looking at white Caucasians, Black, and Hispanic patients. There wasn't any data that was presented on Native Americans or Alaskan patients. But I have this feeling that the disparity would probably exist there as well. And anyway, it did show that overall, there was patients weren't as commonly offered a patient portal based on race and ethnicity. And then those who were offered were less likely to access it. And also the access among those who were offered a portal also was higher, but also showed some disparities as well there. Interestingly, the number one reason for not using the portal across the board was that preference to speak with a healthcare provider directly, which I think speaks to the importance of that being able to message their providers or their care teams directly through the portal may be something really important to focus on so that they're not waiting for that call back from the clinic. And the other reasons are listed here as well. It also really highlighted the important role of providers in facilitating access to health information via portals. Providers may be exacerbating disparities by thinking that, oh, this person maybe doesn't speak English well. And so I don't know that the portal, ours is only in English and isn't for them. But many times family members can help. And that also providers can help ameliorate disparities by routinely, just out of practice, offering patient portals to all patients and encouraging use. And with that, I am ready to take questions and hear about what's working well in your clinics and what barriers there have been to patient access of health information.
Lori,
Mona,
thank
were
you.
there any questions?
Yeah, thank you for the presentation. There are no real questions in the chat, but one question that I have, or that we're asked very often when we're dealing with patient portals, you and I have done this work for a while, is how do you encourage the older patient to use the portal? It looks like from your slides, just asking sometimes is the place to start, but what else?
Absolutely. Well, asking is a great place to start. A lot of older folks, elders, do need extra help. They also may have family members who are very, very involved in their healthcare as well. And family members also, can gain access as long as, the patient is permitting that. And I know for many, especially who have children who live a ways away and all of that, and who may just be more knowledgeable or tech savvy, many times are helping their elderly parents through this. And so that would be one thing. The other thing is that, you know, this is something that training can sort of take place almost anywhere. So if there are senior programs that are available, or elder care or elder centers in the community offering patient portal access there, as well as just some help, be it on, you know, how to turn the computer on, to what a telehealth appointment is and how to access that through the portal, or what patient education is available. All of those things really it's part of that whole care team. And then the other pieces is, I know, Mona, you and I have seen some research that really shows that so many older people are much more tech savvy than we would have thought. And many of them, maybe they don't have a laptop at home and they don't feel comfortable with that, but they feel comfortable with a tablet. And many patient portals are offered as an app on tablets as well as smartphones. So those are just a couple ideas that come to mind. Mhm. Any other questions or comments?
Looks like Natalie just unmuted. Anything you'd like to add, Natalie?
Yeah, sure. Thank you for this presentation. We're actually we'll be getting next gen implemented here probably, hopefully within the next 4 months. I think beginning of August is what we're hoping for, but you know, that might be extended. But so we really kind of don't have, I mean, we have a portal right now, patients aren't using it.
Right.
But we're going to be going to having a portal. So, I mean, it's just, there's going to be a lot that we're going to be tackling with that, you know, like what records do we put on the portal, you know, like getting patients to use, well, first, I guess, getting patients to use the portal, and then like getting everything set up for the portal. And then, yeah, so.
Well, thank you so much for sharing. And Natalie, let me tell you, any EHR, you know, implementation is a huge project. So hats off to you, and good luck.
Yeah, I know.
They're usually, you know, I will say this. Here's just a few thoughts if you are sort of rolling out a new portal like this. First of all, you know, don't, you know, this putting in a new EHR, switching EHRs is a major, you know, is a major project. And so I would hold off with the portal, and especially making it, you know, public and everything, until a little bit towards the end of the project, when you feel like you have the bugs sort of worked out. The other thing is that I think, you know, if you're able to, if you have employees who are also patients, that is a wonderful test group for them to have their own user experience with the portal, to sort of see what works, and they might be able to find some of the bugs, or some of the features that are really neat, that they find valuable, and then, you know, they can sort of sell it to patients then, because they themselves have experience with it. So that's one example. The other piece is that, you know, maybe it's in stages. So, you know, kind of starting small. Most portals will automatically, you know, show upcoming appointments and the notes, the after visit summaries. And maybe that's just a good place to start. Before you get into the more advanced functions of, you know, requesting appointments and you know, being able to request refills in the portal. So those that's just a couple things to consider. And if you'd like to talk more offline, I'd be happy to answer further questions too.
Okay. Yeah, great. Yeah, thank you. I think that's a really good suggestion. I guess I didn't even think about that. I'm like, oh, it has to, you know, obviously it's probably hard to get everything up and running all at the same time, because I imagine, yeah, we'll have like issues just in the EHR itself that we're gonna have to work through. And then, yeah, having multiple issues is not gonna make it any better.
Lori, I
No.
like your suggestion of really working with your staff, Natalie,
Yeah.
to get them to sign up for the portal early in the
Yeah.
process. So, and they, even before you kind of launch it, let them maybe test the portal for you. And I think, I mean, I worked in clinics for a long time and kind of in the early days of the portal. And if the staff members had no experience with the portal, it was really hard for them to suggest it. So I think that by having them be the early adopters, kind of kills two birds with one stone. You're able to test some things, and also they're going to be better equipped to get your patients signed up.
Yeah. Yeah, that's
Exactly.
definitely a good idea too.
Yeah.
Good luck.
Yeah.
Thanks,
Good
yeah.
luck. Yeah, it's a lot.
Yeah, we're working
It's
on
a
the
lot.
data conversion right now, so we're at that
Oh,
stage, and it's, I think, getting a little bit held up, but
Yeah.
hopefully it'll go smoothly.
yeah, that
Lori,
can be
I
a
don't know if this is
difficult
a
process.
question that you could address or not, but how does information blocking and patient portals how do those two topics intermix?
Oh gosh, Mona, that's a very good question. And so for those of you who aren't familiar with information blocking, through the Cures Act, there is specific specific requirement that really takes HIPAA's right of access and goes from sort of that any permissible disclosures now become required disclosures, is I guess the best way to sum that up. And I think, patient portals can help with compliance. However, they also aren't necessary, and they aren't always, like to Natalie's point, you're thinking about what you put on the portal. Well, if a patient really wants more in-depth records, or records that do, they do have the right to access all of their record, not just what's in the portal. However, I think it's an important tool. The other piece of it is that same sort of area, it also helps interoperability between organizations, and, for the data to flow, once again, with correct consents and under the correct conditions as well, which also is an important piece of information blocking. And I will say this, if anyone is interested in learning more about information blocking, and I don't have this right in front of me, but we do have a very nice e-learning module on the MetaStar website that does talk about information blocking and provides just a high level background. It was actually designed for smaller clinics, and so it would definitely give you more of a background in that. Does that help, Mona? Perfect.
Is it okay if I ask
Absolutely, go
more questions?
ahead.
Okay, great, thank you. I did do the information blocking on the MetaStar thing. That was helpful.
Okay.
I feel like that's definitely a pretty big complex. I feel like I get a little lost in it, especially when they start talking about like the exceptions. And
Yeah.
I went to the HIPAA Cow conference here.
I did too.
Yeah, I think I saw your name.
Yeah.
I think somebody had asked a question in one of the chats, like, is it information blocking if you're not responding to another provider? Within,
Yeah.
like if you're saying, no, we need an authorization, or if whatever they're saying, they need an authorization before they can release information. And I think I've seen this on AHIMA too, like somebody had asked this question.
Yeah, it depends. And I will say this, that, I am one of those that are learning about information blocking and all of that as well. And, I mean, if there's any specific questions, I would always say to, talk to, counsel. And so anything that I say is really for educational purposes, but if consent is not required for the exchange of information, then it would be considered information blocking unless you have some specific policies and such around it. So the idea is to reduce the barriers to having that information flow. Now, I will say there's a huge caveat, and that is for SUD, substance use disorder information, which is protected under 42 CFR Part 2, which many folks are familiar with, that really puts that kind of information at a different class. But let's say that you're a family practice and you're being requested for some information on a patient by a hospital, just as an example, that under HIPAA is permissible. Information blocking means that you're required to provide that information. Does that help, Natalie?
Yeah, it does. Yeah, thank you.
Mhm.
I had kind of thought that's what it may have meant. I think I had the answer that I had seen in that HEMA thing had basically said the same thing. So yeah, it is
Mhm.
helpful.
Mhm.
And yeah, I think it's just like, it's gonna, like some of these big rules, it'll probably just take some time to learn them. And then we have time for one more question, or does this
Yep.
go till one?
Absolutely. Yep.
Okay, perfect. Thank you.
Mhm.
And this is just maybe, I don't know if an opinion, but like, does patient right of access, like, let's say a patient's like, I want this email to me.
Mhm.
And I feel like, I've asked others, I feel like maybe I've gotten mixed opinions on like the use of email for like a release method.
Mhm.
Um, like if they say, I want this email to me, is that like, and you say, no, we can't do that, but you have the capability of doing that. Is that like an issue, I guess?
Yeah, I think here's a few different thoughts on that. Is that may be a place where you can recommend the portal and say, it's more we prefer not to email because we know that our encryption is there. However, yours may not be. And or just depending on the service provider and all of that. And so that could be a good way to say, hey, listen, that is available on the portal. It is more secure, that direction. However, I will say that, I mean, if a patient says, you know what, my email is secure and, just email it to me, then they're kind of taking on that risk, technically, for themselves. Now I do know organizations do have encryption, worked in for emails like that. And so it really, depends on clinic policy and the direction that you want to take. But I will say that that's kind of a really great time to recommend the portal and use of secure electronic messaging, which does have very high encryption standards.
I would also maybe think that making sure that you have a policy at your clinic or your organizational level that says either we will do this if the patient insists, or we will not. So that I think sometimes it comes down to, are you following your own procedures, especially when it comes to that security risk analysis that you've got to do every year too, is are you or are you not following your own procedures? And that could be at your organization level. Like if a patient it absolutely insists, yep, we'll mail it to them, or we will not, or email it to them. We'll print it out and send it to them in the snail mail.
Or the use of the portal and
Yes.
secure electronic messaging many times looks very, very similar to email. And then it can even be connected to a person's email, because you may kind of get that as a pushback. Oh, how am I going to know if there's a message? Well, you can have it where most portals will kind of say, hey, Lori, you have a new, there's a new message, go log into your portal, and provides that link, and you just go there and you can see what the message is. And many even have the capability, to send PDFs or to attach things to it, and such. And so those are some ideas, Natalie.
Yeah, thank you. Yeah, that really definitely helps. Because I'm actually working on our email policy right now.
Okay.
I'm updating it. So
Okay.
that was one of what I put in there, because my language, sometimes unfortunately, I have to like research stuff like on the web, and like also try and find other policies that, like I feel like would maybe help, but I didn't, like the language I'm using, it's like, I don't know if they actually have the right of, like, if this is their right as like patient access rights, or
I don't, do the patient access rights really say how the
yeah,
patient? It's really, do you give them access? And sometimes the way a patient asks for access may not be appropriate, but you're giving them other options.
Right.
And as long as you're not saying we're not telling them, no, you can't have that in any way, shape, or form, I think you're fine.
Okay, yeah, and I'm sorry.
Yeah.
Yeah, I was kind of trying to work with our IT team too, to make sure, this is something that we can do, that we have the appropriate encryption. It's AES 256, which I think is like double encrypted on each end. It's Barracuda. So they said they were okay with it, but I am in the policy. I'm like, okay, it needs to be used if maybe I said they may ask for it.
Yeah.
Last case scenario, kind of like, that wasn't my exact wording, but it like has to be used very judiciously and with extreme caution. And then I list like certain things that there's only really a few people that can really actually send out medical records in our facility.
It is a last case scenario, and staff know first suggest the portal and then do this, and then, but if none of that is acceptable, here's what you do.
Yeah.
Okay.
And I like that you limit who can send out medical records at your organization, because
the other piece of that, and once again, kind of, you can tell that I'm a fan of the portal, both for patients as well as for the clinic, is that if you're using the portal, then there's a readily available, log of that. And it is connected directly to the patient's chart. And so that as well is kind of a benefit of getting information through the portal. But I agree with what Mona said as well.
Yeah, definitely. I definitely feel much more comfortable. It's such an easy flow. It's like you're in the portal. I worked on Epic where I could push records to the portal, and it's just way so much better than having to open up your email. And then in the facility I worked at, it was large, and we had a lot of email requests, and you did get used to it. So but we had a huge security team, and all these, like everything was insured to be up to standard, basically. So, we had those resources, and it was something you got used to. But then in smaller facility, you just got, I definitely know you got to make sure you're covering your bases and making sure it's secure. So, but and I am totally very excited about this portal once we get going, and like with the education and, eventually what patients can use it for. So I'm excited.
I'm really excited for you guys. That will be a major upgrade.
Yeah, we're looking forward to it.
Yeah. Anything else, Natalie, that's going on at your facility, or thoughts or on any barriers or any other questions that you may have?
Let's see. I feel like I always have questions.
Well, I suppose I should advance to the next slide, which has my email, so that if you do have any other questions or want to talk a little bit more, in depth offline, please feel free to reach out to us. We're excited to be working in this space and providing, information for both clinicians as well as for patients around digital health literacy, because we do feel that it's like a huge, important topic in a great way for patients to get more involved in their healthcare as well. So, yeah. All right. Well, if there aren't any other questions, I'm sorry, Mona, was there anything
I was just going to close things out. So, but if you want to do that, I mean, I was just going to thank everyone for coming today, and great discussion. This was recorded and will be posted on our website or our YouTube channel shortly. So hopefully other people can tune in and benefit from this discussion that we had. Thank you very much. And with that, we'll say goodbye.
Have a good day, everyone.